Hello, today we will speak about the etiological TB diagnosis. TB diagnosis is difficult diagnosis and it's determined by commission. Diagnostic criteria includes direct diagnostic criteria when we detect Mycobacteria tuberculosis or we have morphologic verification. Such case is defined as definite. And indirect diagnostic criteria, it is a complex of clinical radiological manifestations and anamnesis. Such case is defined as probable but is registered as TB. Etiological diagnosis is a set of different tests which we are using for identifying Mycobacterium tuberculosis. The bacteriologic examination has 5 parts: specimen collection, processing and review, acid fast bacillus MIA classification and results, direct detection of Mycobacteria tuberculosis in clinical specimen using nucleic acid amplification, specimen culturing and identification, and drug susceptible testing. Sputum collection. When pulmonary tuberculosis is suspected, it is necessary to obtain at least 2 samples of sputum. For microscopy in general healthcare network, 3 samples. It is important to obtain sufficient quantity of sputum for the testing, more than 3 to 5 milliliters, from the lower respiratory tract. From 1 decontaminated sediment sputum portions are performed smear microscopy, liquid and solid culture media, PCR for the detection of Mycobacteria tuberculosis. If possible, specimens should be obtained in an airborne infection isolation room or other isolated, well-ventilated area, e.g. outdoors. On this picture you can see TB patient coughed up sputum and is spitting it into a sterile container. The patient is sitting in a special sputum collection box that, if properly ventilated, prevents the spread of tubercle bacilli. And on this slide you can see diagnostic value of sputum microscopy in patient with suspected tuberculosis, and you can see that first sample of sputum have 84.5% of positive results, and the percent of positive results decreases from sample to sample. And now it is a time to speak about specimen collection methods for pulmonary TB disease, and first method is coughing. It is most commonly used method of sputum collection. Coughing should be supervised to ensure that sputum is collected correctly. A healthcare workers wearing the recommended personal protective equipment should coach and direct supervise the patient when sputum is collected. Patients should be informed that sputum is the material brought up from the lungs, and that mucus from the nose or throat and saliva are not good specimens. Unsupervised patients are less likely to provide an adequate specimen, especially the first time. The next method is sputum induction. It's for patients unable to cough up sputum. Deep sputum producing coughing may be induced by inhalation of an aerosol of warm, sterile, hypertonic saline. Because induced sputum is very watery and resembles saliva, it should be labeled induced to ensure that the laboratory staff workers do not discard it. And the next method is bronchoscopy. It's a medical procedure that allows visualization of the inside of a person's airways. The airways are called the bronchial tubes or bronchi. Bronchoscopy might be needed for specimen collection, especially if previous results have been non-diagnostic and doubt exists as to diagnosis. At other times, bronchoscopy is considered because TB is among several other diagnoses being considered. Bronchial washing, brushings, and biopsy specimens may be obtained depending on the bronchoscopy findings. Sputum collected after a bronchoscopy may also be useful for a diagnosis. A bronchoscopy should never be substituted for sputum collection, but rather used as an additional diagnostic procedure. And the last one, gastric aspiration. It is a procedure sometimes used to obtain a specimen for culture when a patient cannot cough up adequate sputum. A tube is inserted through the mouth or nose and into the stomach to recover sputum that was coughed into the throat and then swallowed. This procedure is particularly useful for diagnosis in children who are often unable to cough up sputum. And specimen collection methods for extrapulmonary TB. You know that TB disease can occur in almost any anatomical site. Thus, a variety of clinical specimens other than sputum may be submitted for examination when extrapulmonary TB disease is suspected. Procedures for the expeditious and recommended handling of the specimen must be in place or assured before the specialist performs an invasive procedure to obtain the specimen. Especially important is rapid transportation to the laboratory according to the laboratory's instructions. Please note that very important that the portion of the specimen placed in formalin for histologic examination cannot be used for culture, so you need get one more specimen for the culture without formalin. On this slide you can see the whole algorithm of etiological TB diagnosis that you have to perform before start TB treatment. And you can see that there are three levels of or three steps of algorithm. And first microscopy, second culture and molecular genetic tests. We will speak about all these parts later, and you have to know that these tests do not replace but supplement each other, and all tests are performed from one portion of sputum. All methods of Mycobacteria tuberculosis detection, I mean etiological methods, are divided in two groups. First, classical microbiological methods based on the phenotypic features of Mycobacteria tuberculosis, and here you can see microscopy, solid and liquid media. And the second group is molecular genetic methods, detection of the pathogen using nucleic acid amplification. And let's start from microscopy, the first and easiest methods for etiological diagnosis. And there are three types of microscopy. The first one, direct smear bacterioscopy stained by Ziel-Nielsen, luminescence microscopy, and light emitting diode microscopy or LED microscopy. And the advantages of this method are low cost of test and the rapid result, so you can get your result in 3 hours after the collection of the material. And also this method have disadvantages, and they are that this method does not allow to differentiate if acid-fast bacilli belong to the Mycobacterium tuberculosis complex or it is non-tuberculous Mycobacteria. And the second disadvantage is that this method allows to identify Mycobacteria tuberculosis only when in 1 milliliter of sputum when 1 milliliter of sputum contains at least 5,000 or 10,000 Mycobacteria tuberculosis. So it's not very good resolution of this method. With a small amount of Mycobacteria tuberculosis in sputum, this method is not effective. And here you can see the picture that you will see in the microscope when you're doing the microscopy. If you use the first type of microscopy with the Ziel-Nielsen stain, you can see on the blue phone red sticks. And these red sticks are Mycobacteria tuberculosis. And if you will use fluorochrome stain, you will see the black phone and fluorescent sticks on this phone. And how we can classificate the results of the acid-fast bacilli smear. So we will see in results, we can see if it is a positive result, so we will see one of these results mentioned in the first column of this table, and the second column is telling us about smear interpretation. So is it positive or not or negative? But here I told you that I put in this table only positive results. Yes, different variants of positive results. Strongly positive and moderately positive. And what does it mean if we are speaking about infectiousness of the patient? You can see the answer in the last column of this table. Here is the example of direction for conducting for sputum testing. You can see more in details this in your PowerPoint presentation in 2 weeks. And now is the time to go to the next method. It is a culture, and we have 2 types of culture. First type is solid media, used at least 2 different media. Commonly used the combination of solid media such as Lowenstein-Nielsen and Fin2. And disadvantage of this method is a long period of receiving the results, from 1 to 3 months. And the second type of culture is liquid media, Bactecam JIT 960. The Mycobacteria tuberculosis detection rate of this method is higher compared with solid media on 10%, and accelerates the result On the average, a positive result is obtained after 14-21 days, more quickly than solid media. And currently, this method, liquid media, is the gold standard of etiological diagnosis. Here you can see this BACTEC MGIT for the liquid media test. And detection, here you can see the detection of mycobacterial growth in MGIT system. The growth of microorganisms is recorded optically. It is based on fluorescence, which occurs when oxygen is consumed by mycobacteria in the process of growth. Oxygen-dependent fluorochromic dye is found on the bottom of a special test tube and covered with a layer of silicone. Division of mycobacteria leads to a decrease in the amount of oxygen and its concentration in the tube, which causes an increase in fluorescence, which becomes visible when the tube is irradiated with ultraviolet light and automatically recorded by photosensors built into the BACTEC device. And on this slide you can see decrease of positive culture results. So up to 10, the exact number of colonies we wrote in the laboratory specialist wrote as the result of the test in exact number of colonies. If colonies more than 10, from 10 to 20 colonies it's +1, and from 20 to 100 colonies 2+, and more than 100 colonies continuous growth 3+. And the next method of etiological diagnosis, third step in our algorithm, previous we spoke about it, molecular genetic testing. The PCR method is widely used based on the detection of species-specific sequences in the genome of mycobacteria. The method has proved to be highly specific and sensitive. Preferred are test systems with real-time detection of the result. The resolving power of the method is 50 to 100 microbial bodies in 1 milliliter of diagnostic material. Obtaining a positive result by the PCR method does not require additional differentiation of Mycobacteria tuberculosis from non-tuberculosis mycobacteria, because of positive result clearly indicates that it belongs to Mycobacteria tuberculosis. At present, there are a huge number of test systems for PCR detection of Mycobacteria tuberculosis DNA in Russia, differing in the way they detect the results. And here you can see the screen and of result of PCR test. It looks like this picture. And one of the molecular genetic test is Gene Expert test. WHO recommended of using this test rather than conventional microscopy, culture and drug susceptibility testing at the initial diagnostic test both in adults and children suspected of having MDR TB or multi-drug resistant TB or HIV-associated TB. So it's a strong recommendation, high quality evidence. And currently we use GeneXpert in especially among people living with HIV. GeneXpert quantitative Mycobacteria tuberculosis DNA extraction and rifampicin resistant determination. And why it's very important to know about rifampicin resistant of the Mycobacteria, because it is a marker of multi-drug resistant tuberculosis. It's very rapid test, so we can use it for the correct treatment management of patients with multi-drug resistant TB. On this slide, we can compare the sensitivity and duration of the different Mycobacteria tuberculosis detection methods. And if you will see, you see that molecular genetic testing is last. The most sensitive, because the sensitivity of this test is more than 10 in 1 milliliter. It's enough to have only, for example, 10 microbial cells in 1 milliliter to detect this Mycobacteria tuberculosis. And it is most sensitive test and fast, very fast test, because it took only 1 day. Okay, you can tell me that light microscopy also very fast test. Yes, fast, but how about sensitivity in light microscopy? And if you will, as you see, it is to have a positive test light microscopy, we need to have more than 10,000 microbial cells in 1 milliliter of specimen. And here you can see that the molecular genetic tests and microscopy tests should be available for patients with suspected TB in the general healthcare network for the right diagnosis. And as I mentioned before, that liquid culture media is the gold standard of etiological diagnosis. Identification of Mycobacterium species. Positive cultures are tested for the differentiation of Mycobacteria tuberculosis from non-tuberculosis Mycobacteria, and bacteriological laboratories of TB services should at least differentiate Mycobacteria tuberculosis from other non-tuberculosis Mycobacteria. Additional identification to the species level is mandatory only for interregional bacteriological laboratories. And on this slide you can see the scheme of Mycobacteria detection by using usual microbiological methods, bacteriological laboratory of TB services, and here you can see the average duration of each method. We have to provide microscopy, culture, retold the solid and liquid media, and immunochromatography of biochemical tests to understand if it is Mycobacteria tuberculosis or non-tuberculosis Mycobacteria, and provide drug-susceptible testing for this Mycobacteria. Drug susceptibility testing of Mycobacteria is important for choosing the right chemotherapy tactics and monitoring of effectiveness of treatment. Drug susceptibility tests for TB are basically of two different types. First type is phenotypic drug susceptible testing methods. The result can be obtained from 7 till 21 days after the culture has been grown. And the second type is genotypic drug susceptible testing techniques allow to identify specific mutations associated with resistance to certain TB drugs. The result can be obtained 1-2 days. Additional information about types of drug resistance you can find in mandatory part of materials on TUIs. The frequency of Mycobacteria detection in sputum depends on, first, quality of laboratory testing, and second, characteristics of the tuberculosis process. If there is a local tuberculosis, tuberculoma, and limited infiltrate without cavities, the probability of Mycobacteria tuberculosis detection is low. If there is a cavernous TB, the Mycobacteria or large processes in the lungs with the cavities and so on, the Mycobacteria in sputum must be detected. And let's speak a little bit about additional etiological diagnosis methods relevant for patients with TB, HIV co-infection, and it is very important issue on today. So, in additional tests for the detection Mycobacteria tuberculosis by means of blood culture. Currently, several analyzers are used to isolate Mycobacteria from the bloodstream. You can read it on the slide, and on the picture you can see how they look. And it is most likely to detect Mycobacteria tuberculosis with the blood testing in people living with HIV if there are the following symptoms. First of all, immunosuppression, CD4 in the range of 1780 cells, and fever, severe anemia, paratracheal lymphadenopathy, miliary dissemination. The presence of Mycobacteria tuberculosis bacteremia is associated with a high up to 60% level of mortality. Unfortunately, it's true. And one of the good tests for which can help, additional tests which can help us with the diagnosis in people living with HIV with immunosuppression. It is a lump test. Unfortunately, this test is still not registered on territory of Russia Federation, but some countries have this test, and the life of the physicians became easier, I think, with this test. So We have policy recommendation from WHO for the use of this test, except as specifically described below. For persons with HIV infection with low CD4 counts or who are seriously ill, lump test should not be used for the diagnosis of TB, but it may be used to assist in the diagnosis of TB in HIV-positive adults and children with signs and symptoms of TB, pulmonary and/or extrapulmonary, who have a CD4 cells count less than or equal to 100 cells, or HIV-positive patients who are seriously ill regardless of CD4 count or with unknown CD4 count. And lump test should not be used as a screening test for TB. The diagnostic algorithm for TB detection in people living with HIV includes such parts as compliance with sputum collection instruction, smear and culture preparation techniques, various any possible diagnostic material testing for Mycobacteria tuberculosis detection, inclusion of molecular genetic methods of Mycobacteria tuberculosis detection from sputum and other diagnostic material into the diagnostic algorithm, given the high probability of bacteremia. A bacteriological testing of venous blood for all common infections is desirable for all patients, and for Mycobacteria tuberculosis for individuals with CD4 less than 100 cells, with a baseline CD4 plus count of less than 100 cells. LAM test and testing are recommended, especially in patients without sputum and weak cough reflex. And here on this slide you can see the complex morphological examination of biopsy material in patients with HIV infections, and it includes mandatory part and desirable part. And mandatory part is are macroscopic evaluation, cytological examination, microscopy, and histobacterioscopy, the chillness and stain. And desirable part is PCR tests. And at the end of my presentation, I want to tell you that to note that absence of Mycobacteria tuberculosis in sputum or other diagnostic materials does not lead to exclude disease. So remember that tuberculosis diagnosis is a complex diagnosis. And thank you for your attention. See you soon in class.